for anybody who might miss the meeting and wants to watch it later. And then I'm going to open the floor for everybody to share. If you are new and want to share who you are and what you do, if you have an event coming up, whatever y'all want to share with the full group, y'all go ahead and share away.
I'll share. This is Gabby Smith with the Tennessee Commission on Children and Youth. I've actually just started this position back in July. I was with CCHT for a couple of years, so excited to still be serving this area. We do have an event coming up. It is on September 19th. It's a Tuesday from 10 to 2 in Johnson City, and it's open to anyone. It's youth suicide prevention. It's a training we're doing along with Casey Caudill from the Mental Health Association of East Tennessee. It is a free training, and we're going to have a light lunch provided from Cranberries in John City. If you've never been there, it's a gym. So we're really excited. If you want to sign up for that, I'll put the link and the flyer and all of that in the chat for you guys. And then if you were previously a member of TCCY with the wonderful Miss Jill Stott, and you are wondering about your membership status, if you're paid to date, those do go from year to year. It's only a $20 fee for a whole year, and you get access to all the good things that we do, and you also get CEU credits for the trainings that we put on, and we try to put one on at least a quarter, if not two a quarter. So if you have any questions, I'll put my info in the chat. Thank you.
Hi, my name is Aline Lotus, and we are with Ready Go Senior Transport. We're a new business in the area, and we basically do transportation for elderly, wheelchair-bound people, patients of any kind, for people that are not, that need a little more than Uber, but you also don't want to use NetTrans. So we're just a new company. Our website is www.readygoseniors.com, and we're just getting established in the area. So we just want to let people know that we're here and we're available for all kinds of patient needs, or just even transportation to regular hospitals, or I'm sorry, regular appointments for hair or social outings, things like that. We travel, we cover the Tri-Cities area, and we do go from city to city. I know NetTrans sometimes only does within the same city. So hello again, my name's Aline, and my husband Louis is not here, but he's the other part of my team. Thank you.
And being a new face, big face, I don't know why my face is so big. My name is David Varney. I'm the new executive director for the Greene County Anti-Drug Coalition. And two of my ladies who have been working part-time for a year or so said this would be a good group to sit in on and learn some stuff. So I'm just here kind of eavesdropping.
Hello, my name is Wendy Ramsey. I'm the Region 1 Substance Use Disorder Housing Facilitator.
I'll go next. Hello, everyone. My name is Caroline Rodriguez, and I am with Tennessee Voices Strong Families Nurturing Parenting Program. I'm a facilitator of Nurturing Parenting. It's great to be here.
Hi, my name is Shelly Parham, and I am the CEO at the Boys and Girls Club here in Elizabethton.
Hello, I'm Terry Rogers. I'm the outreach worker for Volunteers of America. I've been traveling doing outreach.
Hello, I'm Angie Sproles. I'm with Goodwill Industries of Geneva, and we do a wide variety of things focused on helping people access employment, especially those who have barriers such as criminal justice, involvement, veterans, people age 55 and older, and people with disabilities. So we are actively trying to help them find jobs and job coaching.
Hey everyone, I'm Rachel Dean. I am the director at the UT Extension office here in Carter County.
Hello, everyone. I'm Brooke Atchley. I'm the program director for Strong Families Northeast Tennessee, and I'll be sharing with you more about that later.
Tony DeLucia, East Tennessee State University, College of Medicine. Like Angie, focusing on veterans right now, but hoping to expand it to all vulnerable populations and the topic of resilience. Please get in touch with me if you're interested.
Hi, I'm Randy Byington. I'm with the ETSU Rural Health students from the College of Medicine that work mainly at Little Milligan Elementary School. I also do research methodologies for a lot of different purposes, I guess I would say.
Hello, everybody. My name is Tyler Wright. I'm the Northeast Regional Health Council Coordinator. I just wanted to go ahead and make a update about our county health assessment. If you get my emails, you saw that the data package was sent out as a draft. I hope everyone had some time to look over that. In our Committee C meeting today, we're going to be kind of going through that, making sure it looks good, making sure it's usable by everyone in the group. And then also, I wanted to announce that the Carter County Collaborative will be holding a strategic planning meeting the 27th of September. This will be an in-person meeting from 11 to 12:30, and that will be at Jillian's place over there in Carter. That's open to anyone in the Carter County Collaborative that would like to attend and be a part of the strategic planning process. This will be catered, so we will have a lunch there. And then I also wanted to segue into introducing Miss Cawthor. She is a student that I'm working with in my health councils. She can give you a little bit more information about this research that she's doing about radon, but she is going to put a survey in the chat, and if anybody has some time today would like to take part in that survey, definitely helps her out and helps you out too, because there goes into a drawing to win a free radon test kit. But I'll let her introduce herself and her project. Thank you all.
Thank you, Tyler. My name is Kawthar Al-Kassir. I'm a third-year doctoral student at ETSU. Public health, I do community and behavioral health. And like Tyler mentioned, I'm working on my dissertation, and I'm interested in radon. So if you don't mind, I'm going to drop a link in the chat for my survey. And if you have a minute and you would like to participate, please feel free to do that. It's completely anonymous. It's completely voluntary. So please don't feel like you have to, but please do. Also, like Tyler mentioned at the end, you can provide your email and you will enter a drawing to win a free radon test kit. The survey is easy questions, what do you know about radon and stuff like that. So I don't think it's going to take a long time. And thank you for your participation.
Okay, anybody else want to share an update or do an introduction before we move on to our speaker?
Oh, one last thing. So I know everybody receives my reminder emails for the monthly CCC meetings. I will be sending out a reminder email this month for that in-person strategic planning meeting. So you're going to get 2 different reminders for 2 different meetings from me this month for upcoming CCC meetings. Just make sure you're kind of paying attention to which those are, and put them on your calendar accordingly. Just wanted to make sure everybody knew that. Thanks, everyone.
Okay, friends. Well, I am going to go ahead and introduce our speaker for today. I'm super excited to have Brooke with us. Strong ACC, as I'm sure many of you all are familiar with that organization, and they are doing amazing things in our community for collaboration and really for meeting needs that have been unmet in a lot of other spaces. And so I'm really excited again to have Brooke share with us about one of their newest initiatives. This is something that no matter what county you're in our region, will be helpful for you. So I'm going to turn it over to Brooke.
Awesome. It's so good to be with you all. Jillian, is it possible for you to give me permission to share my screen?
Yes, try it now.
Okay. Yay. I'm not going to put this in presentation mode, so I hope that you all can see this and you're okay with that. But want to tell you a little bit about Strong Families Northeast Tennessee. We are a Tennessee Opportunity Pilot Initiative funded through the Department of Human Services. And really, we are looking at helping folks who find themselves in situations that they're just struggling. We're talking about families who are in poverty, maybe generational poverty, folks who are just struggling to move forward in life. And so this grant came about. It is using leftover TANF funds that the state did not use. And so there are 7 of us across the state. So we are the only one in our region. It is a pilot. We are trying some things on a broad scale that haven't been tried before or have been tried on a really small scale, and we are collecting data to help with folks across the system. So a little bit about this. So the grantor is the Department of Human Services. We partner with the First Tennessee Development District. They are our fiscal lead for the grant and the grant managing component. The program lead is the Strong Accountable Care community. If you are not part of the Strong Accountable Care community, I would love to invite you to look at that. Let's have some conversation about that. The Strong Accountable Care community is a coalition of over 400 agencies now across our 23 counties in Southwest Virginia and the 10 in Northeast Tennessee, who are all working towards improving the economic outreach and outlook for folks in our region. And so if you don't know, the Strong, all capital letters Strong, stands for striving towards resiliency and opportunity for our next generation. And we could spend this whole time talking about the work of the Strong ACC, but the Strong ACC is the program lead for Strong Families. And then our fiscal backbone for our part of that grant is Ballot Health. And we have numerous local and national program partners throughout this program. It is a very, very robust program. And so we're going to kind of fly through some of this information so that you can ask me questions, because people have more questions than sometimes we can get to. But this is our 10 county region here. We serve all the upper 10, the upper 8 of Northeast Tennessee that we normally look for, plus Hamlin and Cott County. And so we have a team deployed throughout that region, and we're accepting referrals. We'll talk more about that here in a minute. But we do cover all of Upper East Tennessee. So it's quite the undertaking. So these are the outcomes. And if you're familiar with TANF at all, which is Tennessee Temporary Aid for Needy Families, you will recognize some of these. So I'm going to let you read that. I don't have to read it for you. We're all smart adults here. But know that we understand that to meet any of these outcomes, we have to approach the entire family. We understand that poverty is not just a lack of financial resources, but also of all kinds of resources. And if we can't address the other issues that are in our society and in our families, we are never going to help move families towards self-sufficiency, which is the ultimate goal of this program, is to help people move from not being self-sufficient towards self-sufficiency. So we are looking at all aspects. So a 2-generation model, holistic family services, if you will. So we really, and we can talk more nuts and bolts about that. So, so we have several partners. We're looking at 4 main pillars, if you will. Access to mental health and mental and behavioral health and substance use disorder. So we have contracted through the grant with Frontier Health. We are utilizing other services as well. What I didn't mention before is there's actually also a research component to this grant and program. And so we are collecting data on lots and lots of different touch points so that we can talk with folks who make decisions that affect our families with real numbers. We know that numbers move the needle in Nashville. And so we are gathering data very robustly. So one of the pilot parts or initiatives of this is expedited access to mental health services. So we have contracted with Frontier Health. We actually have a position within Frontier Health that meets with our families in Strong Families, because we are testing the hypothesis that we all know is going to be true, that we have better outcomes when we have a quicker referral process. So our families under this contract, from referral to first access, is less than 10 days. And we are already utilizing this quite extensively. So we also partner with Strong Families, which are Tennessee Voices, which we have some folks on here, to provide services for nurturing parenting, to help our families become stronger families and help with some of the issues that come along with just being a parent. How do we support? How do we be better parents? We're also partnering with Appalachian Opportunity Fund to do financial literacy counseling with our families. This is not let's save for the future, but how do we go about being financially educated? Do you have a banking account? If not, let's help that. Are you in a predatory loan situation? Let's talk about getting you out of that. So with part of our grant funds, we have helped AOF fund what is called the Financial Freedom Fund. So when our families are in a predatory situation, we can help back loans from credit unions and other agencies to get them out from that. And we can talk about all the other kind of details that come along with that. And then we are partnering with our educational and training agencies in the region. So we are partnered with Northeast State and Walter State to provide career coaching, to help with HiSET or high school completion, up to training for occupations and college credit if folks so desire. So we're already seeing folks taking advantage of that, as we have several families that are already applied and enrolled. So Strong Families Northeast Tennessee eligibility criteria for families. One of the parents of a child has to be a U.S. citizen. You have to live in one of the upper 10 Northeast Tennessee counties. You have to be eligible for or receiving some sort of public assistance, or have your income at or below the federal poverty level. So we qualify a lot of families through things such as TennCare if they're receiving SNAP, if they're receiving free and reduced lunch. So Carter County, all children receive free and reduced lunch. So anybody from Carter County that has a child would qualify for this program. You do have to have a minor child living in the home or be expecting, or have a active plan in trying to regain custody of your children. So that is one of the caveats of the program. Then our last one is you have to be able and willing to work or participate in further education. So a family who is receiving 100% disability, who have no desire to leave that, would not be a great fit for this program. And I can answer questions about eligibility for that here in a minute. So one of the things that we do provide that's actually the backbone of this program is what we call our Family Partner Program. And so one of the things that we are testing is the idea that a high intensity, low caseload for our family partners help move families towards success. So our family partners are folks who have lived experience with poverty or addiction or both. And they are highly trained to do what's called family-centered coaching. And so the families are in the driver's seat in this program. We don't have a list of things that families are going to check off that they have to do to remain in this program. But there are advantages for folks for these families. So our family partners meet with these families for a minimum of an hour a week, usually at their home or a place of their family's choosing. We acknowledge that transportation is such an issue in our region that families sometimes can't get to the services that they need and or want. And so we are going to them. And they use family-centered coaching to help families set goals that lead to milestones. Milestones have been created that we know when families meet this leads them towards a path of self-sufficiency. So when milestones are met, there is a financial payout for the family. So for example, we are getting ready to make our first round of milestone payments to the families already enrolled and that have met them in our program. And families are receiving milestone payments for things such as meeting with their financial literacy counselor, for fulfilling 100% of the request of maybe a primary care physician or a mental health professional, up to milestones for completing parent-teacher conferences or participating at the school level. It's a very robust plan. In fact, we're pretty proud of the fact that we have the most robust plan of any of the TOPIs across the state of Tennessee, looking at helping put a value to things that we know lead to stronger families, to self-sufficiency before people can put a value on them themselves. So it is a very, very, very robust program. We could spend hours talking about the program, but that's kind of the program in a nutshell. You can see here, this is the referrals. So we've been accepting referrals since mid-June. We have had a little over 220 referrals as of this morning, and we've been able to enroll about 150 families into our program. The research component of this is that some families receive immediate services and some families receive what we call delayed services. They come into the program at a future date that is set as to when they've come in. And we receive feedback from the families in delayed services so that we can compare and contrast and have a really solid data set to share with the state of Tennessee. But Carter County is a little low compared to some of our other counties, so we would love to have more referrals from Carter County. When this graphic was made, we did not have any referrals from Cocke County, but that has changed. These numbers are a few weeks old. But we are super excited about the number of referrals, the quality of referrals that are coming in, and the ability for us to get folks enrolled into the program. So this is how you make a referral. We are committing to, when a referral comes in, contact those families within 5 business days. To be honest, it's much quicker right now. Sometimes it's the day of the referral, sometimes it's the next day, but it's very, very quick. Our enrollment coordinator chats with the family, make sure we're all on the same page, that folks qualify. Then we have a senior family partner that reaches out to that family, makes a home visit, does all the intake processes. And then if the family is accepted into the immediate services, they're assigned a family partner. If they're assigned into the delayed services, we stay in contact with them. We don't get to choose that. That is completely random. It is a complete random control test. We don't even know when we walk in which way the test will come out to keep it straight. And people always ask, "Oh, that sounds so cold-hearted," and it feels that way a little bit. But our families have actually been really excited to know that their voices are being heard. We have monthly and quarterly contact with these families, and they're giving feedback straight to the state. And so they're excited about that. And then they come into the program exactly 12 months from that date. So if someone was to come into the program today and be in the delayed services, they would come into our program September 7th of 2024. And don't worry, we don't leave those families high and dry. If we are in that family's home and we know of immediate services that they need, such as food or what have you, we make those referrals on the spot, give them a list of contacts that they can make to get what they might need for their families. So I have thrown a ton of information at you all at one time, but wanted to fly through that so that I could answer questions for you. So anybody have questions? So I see somebody's having lunch with Corey. Corey Whitfield is our operations manager. He is fabulous. I'll be happy to join with you all if you want, or you can just talk with Corey.
Yeah, this is Tony DeLucia. I'm the one that put that in there. I like to do lunches. So not to take anything away from what we would talk about, but I know Corey worked with the Northeast Tennessee Opioids Conference that was on by the Coalition of Black Social Workers back in February, and that was right in my bandwidth. So depending on how we want to go with a discussion, and maybe some other folks would like to come along with this. We might be talking about, as you said, financial literacy. We might be talking about some things that we're planning on doing with the veterans and the recovery ecosystem approach, because it's all the moving parts. That's why I said I work with Angie Sproles, I work with Randy Byington and many others on this call. Just Emily and Shannon and just so many folks that we're starting to see some movement. We're starting to see some movement on some of those indicators, upstream indicators that you were talking about. And I couldn't be more pleased that this region is taking that kind of a proactive, collaborative, transformative approach.
We are seeing some real movement with families with the high intensity, low caseload model. We all know when we're in this business that that's really what drives change. So we're really hoping to be able to collect that data so that when folks are applying for grants, we can look at that and have that data behind our requests. So we have tons of examples already, even in the short 8 weeks that we've been working with families, that we've been able to assist and help walk alongside, not do for, but just encourage families and help them understand the processes and the pathways that it takes to move forward on some of these issues. Julian, anything that I left out that you think I should talk about?
I don't think so. Anybody else have any questions or comments for Brooke? We appreciate you being here and all the work that y'all are doing.
I will put a plug in if you know of anyone who is looking for work kind of in this field. They don't have to have degrees, they just have to have live experience. We are looking for folks in Hawkins and Hawkins County, Hancock County, and Cott County.
Hey, Brooke, this is David over in Greene County. It may be in the chat and I missed it, but I would be interested in talking to you, especially since you serve Greene County, about eliminating the adverse experiences in childhood.
Sure.
I think that would fall into our anti-drug coalition work. Can I get your contact information?
Absolutely will. And I'll drop that in the chat.
Okay.
And then I can, Jillian, if you have a printout, I can send everybody the referral process and how to get in touch with me.
Yep. If you want to just share your presentation, we can send it out with the minutes.
Hey, Jillian, it's Sean. I'm getting ready to email her. If you'll just send it to me, I'll include that entire presentation in the minutes, including the referral process.
Thank you, Shauna. Okay, does anybody else who joined us late or didn't make an introduction before want to share an upcoming event or activity before we move into our breakout rooms? Okay, well, I'm going to ask both of our committee chairs to share a little bit about what their committee has going on right now. So we'll start with Emily, if you'll share about the data committee and what y'all will be working on today.
Yes, during this CHA process, we've kind of been deferring to Tyler, so he's been leading us and giving us updates. I think we're going to look at our data package that is gorgeous that he's made, if you haven't all looked over that yet. And we're going to talk about our upcoming strategic planning meeting at the end of this month. So a lot of good updates, a lot of good things happening. Thank you, Tyler, and everyone for their work.
Thank you. Tia, will you share what the Substance Abuse Committee is going to work on today?
Yes. So today we're just going to kind of talk about how the International Overdose Awareness Day event goes, and if we want to add on some more events for Recovery Month or over the next couple months.
All right, thanks, y'all. So when your committee is done meeting, y'all are welcome to leave the meeting. I'm going to go ahead and open the breakout rooms now, and y'all are welcome to join either that sounds interesting to you or whichever one you want to do, or you're free to go. Thanks for being here. We'll see you next month.